Good morning, everybody. Looks like the sun makes life so much more pleasurable, doesn't it? And the weather yesterday was absolutely wonderful, wasn't it? So, welcome to our meeting. This is a meeting of the Adult Social Care and Public Health Select Committee. My name is Councillor Sheila Gurney. I'm the chairman of the Adult Social Care and Public Health Select Committee and in the chair for this meeting. But before we continue, I will go over some general housekeeping, please. This meeting is being held in person at County Hall and is also being streamed live on the County Council's YouTube channel. The recording will also be available to view afterwards. A fire alarm test is not expected during the meeting. Well, I think from my previous experience early this morning, we've already had that. So I hope there isn't going to be another one. But if there is, then we must evacuate this room and go to the muster point, the nearest exit. And the muster point is located, as you all know, down on the main car park. This is slightly different. This has been changed. Under the Council's protocol on the use of media equipment at meetings held in public, this meeting is recorded or photographed. Anyone wishing to do so must inform me or my committee clerk and ensure that this is done in a way that is clearly visible to everyone present. The wishes of any individuals not to be recorded and filmed so to the formal items on the agenda. And the first one is to receive apologies and details of any substitute members attending.
Thank you, Chair.
Thank you.
Apologies have been received from Councillor Michael Dulby, substituted by Councillor Brian Long, Councillor Tony Adams, substituted by Councillor John Ward, Councillor Tony White, substituted by Councillor John Fisher, Councillor Mike Sands, substituted by Councillor Alison Birmingham.
Thank you. And I must also give apologies from Councillor Alison Thomas, who is not able to be here today because of family commitments. Thank you. She did ring me last week and have a chat with me about why she couldn't be with you. She would have loved to have been here, but unfortunately, that's not possible. So, well.
And I wasn't on the minutes, so.
You don't know that? We will change that then. I will take them individually. Obviously, we'll update the attendance list there. That's already being done as I speak. So we're looking at page 5, please. Page 6, 7, 8, 9, 10, 11, and page 12. So with that amendment to the attendance list, may I sign those, please, as a true and accurate record of that meeting? Could you agree, please? Can I have a show of hands? Lovely. Thank you very much. That's carried. Thank you. We now move on to declarations of interest. Can I please ask any members if they have any interest to declare on items on today's agenda, please? Thank you. Councillor Bundle.
Agenda item 8, my husband is actually my carer, so there.
Yes, thank you. And Ian, Councillor Ian Mackie.
Yeah, thanks, Madam Chairman. It's on item 8, the carers item. I'm a member of a charitable trustee that provides donations to young carers, in particular the Benjamin Foundation Big Boom Weekend Respite Care. So I just wanted to record that. Thank you.
Thank you. Clerk, have you noted? Yes, thank you. Item 4, updates from the chair. There are no updates, thank you. So we move on to care and commissioning. This is a report by the Executive Director of Adult Social Services, and this is for your information, and officers will now present, thank you. So that's Mr. Chris Scott, I take it, thank you.
Brilliant, thank you, Chair.
Hi everyone. So we're here today to present to you a paper around the transformation and commissioning. So this is a series of papers that are coming to this committee, which kind of detail the commissioning. In particular, there are kind of three areas that I wanted to make members aware of. So the first projects that we've currently got underway as part of the transformation programme for commissioning. The second is the development of our strategic commissioning framework, which is going to kind of guide our activity and decision making going forward. And then the third is the development and implementation of appreciative inquiry learning visits as part of developing a learning culture within adult social care. And I'll take you through a bit more of the detail around each of those three. There are three recommendations as part of this paper. So the first is to note the content in that report that details our transformation portfolio and provide member level support for the work that's been developed and delivered. The second is to review and provide commentary on the draft principles contained within the strategic commissioning framework, and further information can be found as part of Appendix 2. And third is to support the development of a learning culture and organisation that will inform our commissioning approach and practice. So those are the three recommendations that form part of this paper. So in terms of taking you through the main body of the report, I'll draw your attention to section 3 and the proposals. So what I'll start to do is go through each of the kind of areas that I've just highlighted there. So the first is our transformation project. So our transformation programme, which is guided by a very clear kind of value, and I'll just kind of find that now. We've got the transformation project. So the first thing I want to note, which is really important, is the further information that we have included as part of Appendix 1. So we currently have 22 different projects, pieces of activity, work that we're taking forward as part of our transformation programme that's being led through our kind of commissioning activity. The detail included in Appendix 1 details each of those projects. It details the output that we're trying to achieve and the benefits that we expect to achieve as well. As you would expect, each of those projects all have their own business cases and have quite robust information around activity, risks, timelines, benefits, all of those things that you'd expect us to have. And what I've provided to you is kind of a summary of that activity and something that I felt would be quite useful for kind of members to understand. It covers a huge range of activity. So, for example, the work that we're doing around day opportunities is one area. The work that we're doing around the nursing market is another area, and the work that we're doing around technology as well. And so you can see the detail of each of those projects within that. As part of those projects, there's a really robust kind of governance in place to make sure that we are having the appropriate oversight around delivery, but more importantly, making sure that we deliver those outputs that we've identified, and we also deliver the benefits that we're intending to achieve as well. The second point, and the second kind of part of this report, is the focus around our strategic commissioning framework. So we've been doing quite a lot of work within adult social care, working with our partners to develop a framework which is effectively going to detail 10 principles that's going to kind of guide our decision making as commissioners. We feel that's really important that we have this framework in place so that when we're doing our activity, thinking about the development of our services, we are absolutely taking into account these 10 principles. And these principles have been designed, taking into account best practice. We've looked at kind of other commissioning frameworks that are around nationally. We've taken into account other kind of information from ADAS. But really importantly, we've spoken to our partners. And we're kind of still going through a series of engagement work currently to speak to different kind of stakeholders about this. That includes our providers, that includes the Making It Real board. So because I'm here today, my other colleagues is at the Making It Real board talking to people about this strategic commissioning framework and the principles that have been developed. So a copy of this is included as Appendix 2, but there are 10 principles that we've detailed so far. And in 3.6, you can see that these cover the areas of social value, equality, diversity and inclusion, co-design, co-production and engagement, human learning systems, prevention and early intervention, place-based integration, ethical commissioning, also known as the Real Care Deal, risk-positive practice, value for money and digital by design. So those are the 10 principles that we've developed to date, and as I said, we're doing that further engagement work with a number of stakeholders to kind of finalise that as part of our commissioning framework. The one thing I would note, and I'm saying this to all of the kind of stakeholders we're meeting with, is that those principles haven't been co-produced. I'm very clear about that. What we've done is taken lots of information to kind of design what those principles look like. And we're kind of acknowledging that the range of stakeholders that we are meeting that would mean that kind of co-production approach would be quite complex to achieve and to do it in a really meaningful way. The one thing that we've been very clear about, and this is something I've shared with the Making It Real board as an example, is we're absolutely committed to doing the work to co-produce or co-design the detail that sits behind those principles. So, for example, we've already done that as part of the Real Care deal or the development of our ethical commissioning principle that has been co-produced, and we're talking with partners as well about other opportunities around how we might want to co-produce, co-design some of the detail that sits behind those principles in terms of how they are turned into reality and the impact that people can expect to see as well. And then the third and final point I wish to raise as part of this report is the approach to appreciative inquiry or learning visits. So as part of the human learning systems approach that we're developing within adults, is a kind of really key focus and requirement around development of a learning culture and infrastructure. We absolutely understand the importance of learning and how that can really inform our thinking and our approach, but also build on our engagement with our key partners as well as part of that process. We already do a lot of work to capture feedback from our partners. You know, for example, we have performance management conversations, we meet with partners all of the time, but this is about taking a much more kind of focused approach to learning and detailing what we're going to do. So as part of that, we are going out, we are meeting with providers, we are spending time in services, and the requirement and expectation is of all commissioners will be doing this, and already commissioners are doing this, spending time with providers. What's really important about this approach is that we are going to those conversations without any agenda in mind, other than to learn, to listen, and to understand the experience of people receiving care and people delivering care. And that's been really important. Through that process, we're already starting to see the impact on people's kind of understanding. So commissioners have reported back really positively about their experience. We've had really positive feedback from our providers as well. What we are hoping to achieve through that process is identifying areas for innovation as well. And already we've identified a number of different areas that we'd like to take forward with our partners and think about kind of making sure that we continue to deliver innovation within the care market as well. As I said, we're on the start of a process. I also shared the details of that process with our partners at the Achieving Care Together conference. So for those of you that might not be aware, the Achieving Care Together conference is a conference that we put on an annual basis, which is really focused on improving quality within the care market. And I spoke a lot about the learning visits, the intention behind that, and the relationship that we want to have with our partners going forward. And what I'm really pleased about is the feedback I had from those partners was overwhelmingly positive, and I've been contacted by a number of providers and organisations already who are really keen to be part of that process to support us on that kind of work as well. In terms of section 4, you'll see detail around the impact of the proposal. I've already talked about kind of provider relationships and the impact we expect to have there. We also want to make sure that we are learning from kind of the experience of people that are receiving services. We absolutely want to kind of build on our partnership working with our partners. I've already spoken about the importance of learning as part of the human learning systems approach, and this is about how we kind of turn that focus into something that's tangible in terms of those learning visits. It's about making sure that we are absolutely outcomes focused in our activity as well, and making sure that through all of that work, we're achieving best value for the services that we're commissioning, developing for people that are living in Norfolk. I hope that gives you a really good overview of the kind of commissioning kind of activity that we are taking and that's underway at the moment. As I said, there are kind of 3 main areas. The first is the transformation projects and the 22 projects that are detailed under Appendix 1. The second is the development of our strategic commissioning framework, which is going to kind of drive our kind of strategic decision making around how we develop services, what's really important to us when we're thinking about those things. And then the third is the approach to learning visits as part of creating a learning infrastructure and culture within adult social care. Thank you.
Thank you very much for that. I'm going to throw this to the floor now. Are there any questions, please? I've got Stuart, and then I will have Alison, and then Brian, and then Brenda, and then I've got 2 Brians here today, haven't I? I mustn't get confused, must I? That's Brian Long first, Brenda, then Brian, and then Ian. I will call you by your Christian names if that is acceptable. Leslie, are you happy with that? Please, yes. Okay, so Stuart, thank you.
Thank you, Chair. Thank you very much, Chair. Yeah, I've always been highly complimentary, and I remain. Hello, are you okay? Yeah. Well, I have been highly complimentary about the transformation project, and I remain highly complimentary about the transformation project. And I think Ian and the two directors, Nick and Chris, are doing a great job. I listened to that presentation, and as a manager myself, it was full of management speak, and I understand it, most of it. However, I think we need to be extremely careful. This project has got off to a great start, and it's receiving plaudits everywhere we go, and I think everybody, the whole team, needs to be congratulated on this. But I would sound a note of caution. There's a lot of process, a lot of procedure involved in this presentation, which was good and sound, but I think we have to be extremely careful we don't allow the bureaucracy and the process overtake the objective. The objective is to enhance frontline service delivery at a cost-effective price to ensure a better level of service and to make the resource, which are scarce, go further. And I would just, hopefully, I'm going to ask for this to be minuted, that we do not allow this to become an exercise in bureaucracy rather than an exercise in need. As I say, I think we've made a great start, of course, because we are dealing with a multi-million-pound budget. We are dealing with numerous other stakeholders who absolutely have to be engaged, absolutely have to be part of the success. But we must ensure that the mantra of frontline first, the delivery to our customer base, our client base, remains at the front, middle, and bottom, well, not the bottom, the front, the front of everything we do. And I think this must be a really huge consideration of every part of process, every part of procedure. I realise the necessity for it, but I also sound a note of caution that we, inverted commas, have been here before. So I think we made a cracking start, I really do, and I remain entirely supportive, but I also would like that note of caution minuted and recognised. Thank you, Jim.
Thank you. Did you want to comment on that?
Yeah,
Chris, please. Yes, thank you.
If I could, please. Thank you. And thank you for the comments. And I think you've articulated slightly better than I've done this morning about the impact that we want to have and what remains as a kind of absolute priority focus for us. I don't come to work to do process and bureaucracy. I come to work because I want to make things better. My family and myself, have disabilities, and I can see the impact services have, and that's what fundamentally drives me, and that's what fundamentally drives every single person that I interact with in adult social care. So that's at our core, and if I've not expressed that clearly enough today, I want to express that now, because that's what I fundamentally believe in. I think the point that you've made about kind of the way that we've shared it in terms of the presentation, we've absolutely made sure that as part of our kind of presentation and engagement with our stakeholders, we are talking about the right things. So I've been really encouraged by the conversations we've had with the Making It Real board and the kind of work we've done with them. They rightly challenged us when we spoke to them last time about the kind of the accessibility of the information, and we've worked really hard over the last kind of couple of months in response to that to make sure that when we go to see them today, we're having the right type of conversation and that they really do understand what it is we mean by principles and frameworks. So we've been really focused and working really hard on that. Last week at the Achieving Care Together conference, when we were sharing this with providers, overwhelmingly the feedback was really positive. People understood what we were saying, but I think what was really important, and I think the point that you're making there, which I think is fundamentally right, is that people felt there was a step change. They felt that actually there was a change in the way that we were wanting to be going forward. I've worked in adult social care now for a number of years, and I do feel there's a change here, and I do feel there's a real commitment to creating a change. And for me, this is absolutely about delivering tangible outputs and benefits for people. So you'll see from each of those projects what why I've shared that information, because I wanted to give this committee absolute confidence. We're very much focused on the impact and the difference that we can make as well. So thank you for your comments, because I think that they're really well made.
I think Stuart's just got something else he wants to ask you, if he may. Thank you.
No, it was really just to say that I totally, completely recognise that. And I don't wish you to interpret what I said as a criticism. But I understand about lean management. And lean management is vital to actually achieve the outcomes which I know the whole team are absolutely committed to.
Thank you. I have Alison next. Thank you, Alison. Thank you.
Thank you, Chair, and good morning to you all. I tend to think that adult social care will never be fixed until there's a proper care system, and I find it regrettable that we haven't got one as yet. But my question is, I wondered what engagement you'd had with NSFT, the mental health section, and what results you got from that. Thank you, Chair.
Thank you, Chris. Thank you.
Brilliant, thank you. So we're engaging with all of our partners to make sure that they are, aware of our transformation programme in its kind of broader sense across adult social care, but also around the specifics that we're doing. So we had a meeting, we spent a whole afternoon with NSFT and their management team a few weeks ago now to share our respective kind of areas of focus. And what was really encouraging from that conversation is that we all want the same thing, and we're all aligned on how we try to achieve that. So we're absolutely having those conversations, and it will never be finished. It will always be a continuous conversation we're having to make sure that what we're doing is working together to deliver the right services. So that work is underway at the moment, and that work is happening, and there's obviously a series of kind of meetings and conversations that we're having within NSFT, as we are having with a number of other different organisations and providers, because it's really important to us that we have that relationship in place. And that's, again, fundamentally really important to the work that we're doing. So, yes, absolutely, that work is underway and happening as we speak.
Thank you. Did you wish to add anything? Yes, please. Thank you.
Yeah, and I just wondered what the results of those conversations were. Are there any outcomes that you can share with us, please? Thank you, Chair.
So in terms of the results of those conversations, I'll talk about it from my perspective and the conversations that I've been involved in. There's been an absolute commitment to shared working, wanting to kind of drive at the same thing. There are some areas of work that we're currently undertaking that I'm sure that further information can be supplied to this committee should they want to sort of go into that into a bit more detail.
Thank you. Thank you. I have Brian Long for next. Thank you.
Substitute Brian rather than committee on there, Brian. Morning, everyone. On any sort of programme of transformation, how are you going to ensure that you keep resilience within the system as you either move to different providers, move to bigger providers where, smaller ones, you lose a small provider and you've got a little bit of a problem. You lose a big provider, you've got a big problem. How do we ensure that there's resilience to keep the service being delivered? And I'll give you a little example on the paragraph that relates to day services transformation, because it mentions redesigned, personalised, locality-based day opportunities model with flexible alternatives. Yet the day service provider within one of my villages is being cut by the charity that operates it, not renewing the lease. That facility goes. There's only 14 or 15 people go there on a regular basis. But for those 14 people, that's a lifeline. That's where they meet their friends. That's, where they get that social interaction that actually makes their lives perhaps that bit more bearable. And so, in transforming, how do we make sure we don't lose some of the very best that's provided out there, but albeit sometimes by smaller providers?
Brilliant. Thank you for the question. And, at our kind of core work, I also detailed in the paper our kind of priorities. And one of those priorities is kind of sufficiency. It's a key requirement for us to make sure that we've got sufficient market provision. I think in the example you're giving, it's not just about care provision, it's about that kind of support that's available within the community as well, and that's an important aspect. In all of the work that we're doing, part of it is about making sure we have really, really strong engagement in place. We co-produce where we're able to, but absolutely have really strong engagement. And in terms of the kind of day services example that you've given, what we've taken in terms of that methodology is we're working at different places. So we're working over in the east at the moment, and what we're doing as part of that process is making sure that we engage with all the partners in that area. They understand the conversation that we want to have. We understand the conversation they want to have, and we're able to have that dialogue to kind of understand what the impact of any changes might be. And that gives organisations an opportunity to think about the impact on them as an organisation, but also through that work we are creating opportunities. So the focus around the day services transformation is where we want to really focus on how we can enable people to access paid working opportunities and the role organisations might have in able to supporting individuals to achieve and do that. So that's to kind of come back on that specific example. I also think the work that we're doing at Place and being driven through Nick Lynch's kind of area is really fundamentally important to that as well. The way that we've been structured within adult social care is making sure we have that strategic oversight and an overview of perhaps key market areas and how we want to take forward bits of work, but also got that absolute place focus. And at our core, the transformation is about working at Place and how we make sure we develop the services and have the right services in place to meet need and respond to need as well, and make sure that we've got sufficiency there as well. So it's about working at both of those levels, and Nick and I work very closely together to make sure that does absolutely happen.
Yeah, these are elderly people, so they're not, you know, they're well beyond the realms of being retired from work, so they're not looking for work opportunities to get social interaction. They're looking for social interaction to relieve the fact that they live on their own in isolated rural locations, you know, being taken or got to, you know, the day facility there is a bit of a lifeline for them. So, you know, we do need to, whilst transforming, need to remember that it's the folk on the ground that you know that are taking benefit from what services they're receiving, and I get that that probably doesn't stack up for the charity who's operating it on the numbers that are attending, but it's so critically important for those numbers that do attend, and you know within you know there's no bus ride in any direction for those people to find something different to, you know, unless you drag them all the way into town, into Kings Lynn, you know, to a larger facility. So, you know, it's something that we've got to be minded of and not just throw the baby out with the bathwater in transforming when there are services that are providing, you know, on-the-ground solutions to otherwise difficult problems, because there's nothing else in the locality at all.
Thank you.
So apologies, because I didn't realise you were talking about an older people facility, and the work I was referencing was the work we're doing within working age adults specifically, absolutely taking the point about older people and the stage of life, you know, that they will be at as well. I think the comments you'll make are really fundamentally important and strike at the kind of core of making sure we've got the right community infrastructure, and it's about us working with our partners to achieve that. So that's working with our district councils, that's working with other partners to make sure we've got that infrastructure in place, because the support people need isn't just necessarily a kind of day service or a regulated service. Actually, it's about accessing other services that might be available as well that can then meet and help them with their independence, reducing loneliness as well. And I absolutely agree. And I think that's part of a kind of collective conversation. And I do think the work that we're doing as adult social care to have that kind of place-based focus will really make sure that adult social care is coming to the table, influencing, leading and driving some of that focus that needs to happen.
Thank you. Just going back to Alison's response, you have offered to share information with her as she requested, and I'm just wondering if the committee would like it shared with them as well, please. So there's an agreement there. Thank you. All right, that will be minuted. Thank you. I have Brenda next. Thank you, please.
Thank you, Chair. Thanks for the report, and I have to say this looks great. It's very shiny and gorgeous, and I hope it isn't like meringue when you were hoping for a proper meal. We've been given a number of examples over the years of how things have changed and transformed, and last week I was really shocked to read in the newspaper about swallowtail in Acle, and the fact that the care being given at Swallowtail was inadequate and you had to change the care provider. So when you talk about what you've learnt and learning culture, what have you learnt from that? Because clearly somebody took their eye off the ball there and people struggled.
Thank you. Brenda's mentioned the article in the press. I didn't know if you wanted to sort of add that into the comment, because I'm not, I put a slightly different interpretation on the situation myself.
So I'm not here today to talk about Swallowtail and that specific scheme, and I think that would be inappropriate for me.
Excuse me, sorry, no. I wasn't wanting you to talk about Swallowtail. I was wanting you to, in the past we've been told this is a great solution, and we were taken around there and shown an example of a great solution. This report is a great solution, and this is what we're going to do. And I'm wondering, because one of the examples of the last great solution clearly has faltered, have lessons been learnt from that for this new great solution to ensure that something like that won't happen again? I don't want you to give me any specifics about Swallowtail at all. It's just, what have you learnt?
Yeah, thank you. So, I think it's really important to kind of note that actually we're building on some of the really good success we've had in adult social care, and this isn't about what's gone on before isn't worked and what's happening now. We're building on some of that. So some of the transformation projects that we've outlined here have been underway for some time actually. And, you know, you've referred to independent living there. You know, we've got really successful scheme over in Fakenham, for example, and we're building more schemes where we absolutely know that is the right thing to do. And I'm also really pleased with the work we're doing around our supported living programme, which is one of the other transformation projects that we've got in terms of building the right type of kind of facilities that will enable people to have their own front door so they can live independently and have their own front door. And I think that's really important. I think what's really important is that we remain absolutely committed when there might be issues. So we absolutely are committed to independent living, supported living. We absolutely know fundamentally the impact it can have. Yes, there may be things that don't go right along the way, and I think it's important that as part of that process we learn, we understand, and we respond accordingly to that. One of the priorities within our transformation programme is around quality, and we absolutely remain committed to making sure that people in Norfolk receive good and outstanding care, and that's one of our areas of focus as well. We do undertake a fairly extensive quality improvement programme, so we have our integrated quality service that go out and visit a number of different settings and making sure that we absolutely understand the quality of service delivery, but that learning also comes back into the organisation about the things that we might want to do and take forward to kind of support the kind of quality agenda here in Norfolk. So there's absolutely a commitment here to learning, and I think that's really important. There's absolutely a recognition that if things do go wrong or don't quite work out as you would intend along the way, that we respond accordingly to that, and we make sure that we kind of look at that in the context of the kind of wider programme we're taking forward. In particular, focus around that independent living and supported living. Our capital programme is absolutely the right thing to do, and we can evidence countless examples where people are having a really positive experience because of where they're now living, as opposed to potentially moving into a residential setting, which would, you know, not necessarily enhance their independence in the way that an independent living and supported living scheme can do. Thank you.
Thank you. Did you want to come back at all?
Only to say, I guess time will tell. Thanks.
Lovely, thank you very much. Brian Watkins, Brian, thank you.
Thank you, Chairman. And first of all, to thank Chris for his presentation and follow-up remarks. I concur with what most of the other speakers in the discussion so far have said. Certainly, I think the new emphasis on a more relational, place-based approach rather than a transactional one is the right way forward. It's welcome, and I certainly think many of the proposals that you've described to us today, I think are obviously a very important and valuable part of the Directorate's transformation programme. Along with others, I recognise the hard work that has gone into excuse me, into this, and obviously the work that you've carried out with providers and with partners and with the Make It Real group as well, and to sort of that co-production is very, very important indeed. As others have said, it's important to learn from what's gone before, to be able to adapt to that, and to make the service better. And I'm sure that you will endeavour to do that. I think, again, I would reiterate the warning given by Councillor Clancy that it's very important that this is not seen to be a bureaucratic exercise, that this is about assessment of need and improving that for service users. So the three questions I would like to ask, Madam Chairman, if I may, first of all concern delivery risk. We're told in the report that there are 22 separate projects that are running simultaneously at the moment. I wondered if you could just give us some more detail about which of these 22 projects are currently RAG rated amber or red, and what mitigations are taking place. Second question is on home care decline, which Brenda Jones talked about a few minutes ago, with specific reference to Swallowtail. Again, sort of following up on that, obviously recent data shows that we have got ongoing quality issues in home care. So again, what specific interventions do you think will reverse that, and by when? Final question is in relation to market stability, and whether we have evidence that providers do have the financial and workforce capacity to take on the principal provider model at PCN level. Thank you.
Thank you.
Thank you. So firstly, thank you for your comments, and I'm really encouraged that today I'm hearing lots of kind of reflections from members about our transformation programme, which says to me, you know, our messages around the way that we want to work going forward has really landed in a way that's been understood, which is fantastic to hear, so thank you for that. I suppose in direct response to your 3 points that you made, so the first one around which ones are RAG rated, red and amber, I wouldn't be able to provide that information to you today. I don't have that information directly to hand. What I can say is that the governance that we have in place, and I know there's an importance here of a fine balance between good governance and being overly bureaucratic, and I believe we're in the good governance place, and Ian's definitely brought that kind of focus. Our governance makes sure that we have absolutely got a focus and the appropriate oversight of each of those projects. Where there are risks or issues with delivery, we absolutely respond accordingly. And, you know, to say that every project is moving along with no issues or no challenges whatsoever would be disingenuous of me. What you can be absolutely assured of is, though, we adapt, we learn, we listen, we understand, and we put mitigation in place to make sure that overall that our overarching aim for that project is going to be achieved in line with what we've kind of set out. In terms of what we've set out, and I'll kind of answer maybe the market sustainability principal provider, because I think it kind of links to what I was just saying there. A lot of the work that we've done in terms of setting out the outputs that we want to achieve is done through some really extensive engagement work. So in direct response to the development of the principal provider model, that followed a years-long worth of engagement work we did with the care market. That also included looking at kind of other models of delivering home care. And we were very clear when we came to the select committee, I think back in May 23, I'd have to double check that date, the kind of rationale that we reached around the principal provider model and what we wanted to achieve. We remain absolutely committed to that model. We're really excited about the kind of benefits that model will deliver and bring to Norfolk as well. So it is something that we are absolutely minded about. And in particular response to that, one of the key kind of benefits we want to achieve through that model is making sure we've got kind of the right sustainability in the market as well. And that's been a kind of clear and key requirement for that. And then in final response to your kind of question about quality, obviously I think this Select Committee did receive a quality paper not so long ago which kind of outlined our approach to quality. I'm really pleased that overall we've seen an improvement in quality in Norfolk. What we do know is that within home care we haven't seen the same improvement, but nationally there's been a kind of reduction in quality in home care, and that's something that's really important for us to kind of recognise and note. What we are doing is lots of kind of improvement work with our providers, and we are actually undertaking a review of our kind of quality approach. So we're engaging with our partners and our providers, and we spoke about this last week at the Achieving Care Together conference, which is focused on quality, because we really want to kind of co-design our quality approach going forward with our providers to make sure that we are focusing on the right things to improve quality in this space. We are already taking steps to do that. So we have made, as adult social care, investment in areas such as workforce. So our Norfolk Care Careers, we've continued to invest in that, which is focused around recruitment and retention of the workforce. And we've also focused as part of that the development of our kind of leadership capability. So within quality, we understand the importance of the right leadership, in particular, those kind of registered managers. They have a fundamentally important role in kind of quality and providing the right leadership and creating the right culture. So, you know, adult social care is directly investing into making sure that we kind of support the development of the leadership and that kind of registered manager capability. So those are some very specific examples of the work that we're doing to improve quality. I think it is important, though, the point that you made about sustainability of the market, and I think it was referenced earlier by Councillor Birmingham as well, around kind of sustainability of the market and some of the challenges we've got around kind of funding. That was outlined in our cabinet paper that went on the 26th of January, which talked about our fee uplift. So as part of the fee uplift that we've put in place as a council, we also spoke about some of the challenges that we are seeing around market sustainability, some of the feedback that we've had from providers around kind of concerns they've got going forward. And what we do know is that we absolutely need to press on central government to really focus on this, as they are doing currently, but to move more quickly with the kind of recommendations and the funding needed for adult social care. Something else that I mentioned at the Achieving Care Together conference last week is that we've also written out to the Minister for Health and Social Care and the Chancellor as well. There is a letter that has just been finalised and been signed by Councillor Thomas, as obviously the lead cabinet member, and by the Norfolk Care Association, which will be going to ministers, which will absolutely impress on them on that point. And I'll be happy to share that letter because we will be sharing that with our providers as well. And what that details in that letter is our concerns about the sustainability of the sector, the focus that we need to have, but also really positively the kind of economic and kind of well-being benefit that social care has. And what we do know from reports that central government have received themselves, that for every £1 of investment, there's a £1.75 economic benefit. And we've impressed on them as well. Because we absolutely know the impact social care has on individuals, but what we're talking about here is having funding that can be that can enable that sustainability. So that letter has been just been finalised and is going to be sent as well, because we believe it's really important we make that point and that we advocate for that funding. So I'll be happy to share that letter so that you can see the content. Thank you.
Thank you. Councillor Clancy-Stewart is just saying that that letter is imperative that we all see. So yes, please copy that. But could it also be sent to all the MPs in Norfolk as well, so that they are aware of how we feel about the situation? Cross-party, absolutely, please. So I'd ask for that through the chair. Thank you. Ian, thank you.
Thank you very much, Madam Chairman. It's great to be able to welcome this paper, and I'd like to thank the officers for the passion and their interest and real dedication to improving the outcomes for Norfolk residents. I think most of us know, whether it's via family or whether it's via our own residents, the importance put on to care when people need it, and that's when the interface with the County Council really comes to the fore. And I don't know about other people, but my experience of family members who have needed home adaptation, coming out of hospital, etc., has been excellent. And I think, based on our inboxes compared to what we get on other matters like highways, this is some way down the list in terms of concerns raised to us by our local residents, which I think reflects on the County Council. Obviously, there will be issues in some areas, but overall, I think it's very positive, and this report can only help move us forward. The couple of questions I wanted to raise. I think Councillor Watkins has already mentioned about the CQC and improvements across the board. And as Chairman of Audit and Governance, we do look at the risk registers regarding, and we've had presentations not so long ago on the work which is going in to improve, particularly care home accommodation for Norfolk residents. So that was one area, but I think you've answered that, and that's following through with the letter, etc. I suppose the question then I did want to talk about, and others have mentioned about building capacity in the market, and no one can underestimate the complexity of trying to manage the social care market. If you were trying to think of anything which is more difficult to try and manage from a commercial or human relationship, it would be adult social care. Well, I've always had the vision of being able to work very closely with our service providers, not only or training providers, so the University of East Anglia, the City College and all the other colleges, and understanding a pipeline of sufficiency and getting to a position that young people are offered, and you mentioned about careers, so you've probably got more to say, and I'll be really interested to hear about that, about understanding what is the pipeline needs of people going into care in Norfolk and what could be done with our particularly young people, and now youth unemployment rising, to signpost people into a career in care. So I'd just like to ask a question about that. Thank you.
Yeah, thank you. Yeah, you're absolutely right. You know, one of our areas of focus is making sure we've got the right workforce that's able to kind of respond to the needs of people. And as you say, it's an incredibly complex area. What we do know is, and one of the kind of points that we've made continuously is the need for increased investment in social care. And as I say, that's purpose of the letter to central government, because we absolutely recognise what we also need to do is to ensure that kind of people working in this are compensated and it reflects the skills that they have, and that's been a kind of key part of our role going forward. And I think as well that also would encourage people to want to think about adult social care not just as a job but also as a career, particularly for young people as well, and that's been an area of focus. We've been working with the Apollo programme, which is in Norfolk, as part of our kind of work around Norfolk Care Careers, about how we can build that awareness. There's a lot of work that we do. We go to schools, colleges to kind of increase the awareness and the positive kind of view around social care, to really make sure that we do encourage people. I do think sometimes I get a bit disappointed by some of the PR that we have around social, fairly negative picture, whereas I think actually social care is hugely rewarding. It's got a lot of challenges, don't get me wrong, but what we do know is there are thousands of people that are being supported every single day to live their lives as they want to live. And what we've also got is hundreds of thousands of people that are committed to doing that and get a lot of kind of value themselves in terms of the impact that they're having on an individual. And I don't think you can put a price on that. And I think that is something I'd like to see us sort of celebrate a lot more and make sure that we publicise a lot more, because I do think as much as we can do the work with colleges and schools to kind of promote social care, what we do need is society to see social care as a really important kind of role, career, and actually that we've got kind of parity of esteem with other roles, for example, particularly with our kind of focus and our work with the NHS. So I think there's a kind of wider point here about how we positively paint social care in a really good light. We don't move away from the challenges. We absolutely recognise the challenges, but we do have to absolutely kind of make sure that people do see this as a job and a career that is really, really valued and can be a really can offer them a lot themselves. Thank you.
Thank you. Did you wish to ask anything else, Ian?
No, that's everything. Thank you.
Thank you. Thank you. Leslie, thank you.
Thank you, Chairman. I think most of what I would like to say has been touched upon, but I want you to know that I'm very much in favour of this programme. We've agreed it, and it's what we need to do. And you have referred to stakeholders. Does this include the small providers, or is it just the larger providers? Because I do get the impression that the smaller providers they're closer to the end user, as it were, and maybe can inform us as well as the way ahead. So, for instance, were those smaller providers at the Achieving Care Together conference? There's one little question. And value for money appears quite in the report, but surely it's value of the visit. And I am concerned, as I said, about the big providers who won't have that common touch, as it were, with the people that are being visited, and how are we going to overcome that? Value for money is important, but so are the people that we help with care.
Thank you. So if I address the kind of last point first, if that's okay. So I think it's really important that when we talk about value for money, we're not talking about the cheapest price possible. That's absolutely not my aim. That's not the aim of this department at all. What we do absolutely have to recognise, though, is the financial kind of constraints that we have when we're looking at demand and complexity, and that's something we have to absolutely think about. So one of our absolute priorities is about making sure we get value from the services that we're commissioning. That value can be measured in a number of different ways. But one of those ways where you absolutely measure value is the impact it's having on somebody's individual life, the quality of that care being delivered as well. And I want to reassure this committee that is absolutely what we're talking about when we look at value. We're looking at value in a much wider context in terms of the impact that we're having for the money that's being spent, and making sure that, effectively as taxpayers' money, we're getting that value. In terms of your point about the small and medium enterprises, as I refer to, the Achieving Care Together conference was very much focused on those regulated or registered providers. So we had providers that deliver residential nursing care, home care attending, and we had providers of all different sizes attend. And I think it's really important for us, certainly for me, I don't see a difference between a big national provider and a small provider. I think they can all have the same impact. But what we've got to do is make sure that we've engaged with them as part of our process, and we absolutely are committed to doing that. We are also engaging as part of this process, particularly around the development of our strategic commissioning framework with our voluntary sector as well, because we're having those conversations with them, because equally they are as important as our kind of registered providers in the delivery of care and support, and they have a fundamental role to play. So we are absolutely engaging with a whole range of providers, and if there are providers who are interested in wanting to have a further conversation with me and my team, with us in adult social care, I would encourage them to get in contact if they don't feel they've had that opportunity. And what I'd also recognise is that through the individual projects that we've got in place, there's quite a lot of engagement work that's happening with individual providers of all different sizes to make sure that we're learning from their views, we're understanding their experience as well. And part of the learning visits, we're going out and again, we're visiting providers of all different sizes, of all different kind of makeups. So, and I think that's really positive. I myself are going to visit a residential provider that only operates one single home out in the West. Because that's really important that we understand their experience. They have a really important role to play. So I don't think this is about, for me personally, larger providers, smaller providers, and kind of one is better than the other. I think it's about understanding the value that they can all bring, and our absolute commitment to engaging with providers of all sizes, but also making sure that we do support our small and medium enterprises. One of the things we do recognise is that smaller providers may not have the same kind of infrastructure of support as larger providers. So that's some of the work that we do to make sure that we do engage with them and that they can be part of these processes as well. And that's a really important point. And we're absolutely alive to that kind of consideration, and we absolutely make sure that's part of our kind of process. Thank you.
Thank you. If I could just ask a supplementary. The human learning system, we had a briefing on it which was excellent, and it's made me and many others, I hope, understand a lot more. And you've just said that the smaller providers as well as the bigger providers will have an input into that, and so thank you for that.
Thank you. A comment from me, actually. I was pleased to hear about promoting careers in caring and home care in schools for school leavers, but I still personally do not think enough is done to promote the rewarding career. I think it is still seen as something that perhaps is not as aspirational as it should be. I was a carer. I've done home care. I've done lots of nursing and other medical things, and this is years ago now, 30 years plus ago, when it was quite a hard job, and it was tiring, and it was a slog, and particularly lifting patients as well, and enablement in people's homes. But I think that's changed, And Stuart and I experienced that when we went on a visit to Mediquip, actually, the other week. We had and I would encourage actually members of this committee to think about whether they should go and visit, because it really is worth it. It's very, very interesting how technology and equipment has advanced to the stage now where looking after somebody in their own homes is not as tiresome or as physical in terms of manual handling, and that there's a lot more physical equipment available now through the County Council, delivered by this, I thought, excellently well-run service. I was very impressed with it, and I know Stuart was as well. So I think the actual vocation, which I think it is far more and should be far more appealing and rewarding, and should be promoted as such, because innovations and things have changed since my days of doing this. And when I talk about this at my local high school, when they have careers opportunities, I do feel there is a somewhat lack of information and promotion of what I consider to be a very rewarding opportunity for young people who perhaps do not want to go on to university, or, you know, I know that you can go to college and do care courses and things, but fundamentally I don't think there's enough information in our schools, in our high schools and to promote the career itself. So I'd like you to perhaps take that on board. But anybody who wants to go to Mediquip, I'm sure Nick Clinch was there with us, and we had a very good meeting with the people that run that, and then we had a tour around the actual warehouse where they were refurbishing equipment and reusing, and we talked about how to perhaps do equipment amnesties, because there's a lot of equipment about that doesn't necessarily end up back with Mediquip, and it should. Anyway, I'm going to move on now. I've said my piece. So I've got Brenda, who would like to just ask, I hope, supplementary. Thank you.
Thank you, Sheila. Actually, I'm not altogether sure that my question is appropriate. I wonder if I might ask you when we've concluded this, but before we start the next one. It is relevant to the committee.
Okay, thanks. We'll see how we manage that one. Stuart, thank you. Thank you.
Yeah, just, pardon me, just to summarise something which I've picked up during the discussion and the debate, something which Brian Watkins alluded to, which I'd like to reinforce. Really good to hear you using the strapline, make it real, or making it real. I like that, that's good. I think we need another strapline based around the test of success. And I think Brian alluded to RAG ratings. And I think it would be good, again, as much as I am very, very anti-bureau, come to this committee. And I think that would actually ensure that the members of this committee, and more importantly, the recipients of the service, based on clearly defined indicators, that it is working. As I say, I think there's a lot of confidence it is working, it's starting to work, and there's a lot of good feeling about the theory of the work. But I think we do need to be assured that it's actually working in practice. And I think a series of RAG ratings would help coming forward. Maybe, again, that'll be down to the chair or the new chair, whoever. But coming forward, maybe, I don't know, a quarterly or half-yearly basis or something like this, to just so that we can carry out review. Again, total acknowledgement to just so that we can carry out review. Again, total acknowledge we're not going to get all things right all the time. 100% acknowledge that. But it is important we know and understand the journey, and that it can be absolutely evidence-based.
Thank you.
Yeah, thank you. Stuart, yeah, absolutely. We can absolutely do that with all the forthcoming reports. So we've got a suite of measures. Some of them are RAG ratings, some of them are qualitative and quantitative indicators, and we can include that in all future reports. Also, I think it might be helpful for the committee. Something we've started doing, the Health and Wellbeing Board, is also including resident voice stories, so actual examples of where we've got case studies from residents of their experience, and we could absolutely include that in future reports as well, so you get a bit of a taste for the live examples of how this is impacting real people in our communities.
Thank you.
Thank you very much. I'll come back to Brenda now. Thank you.
Yeah, thanks, Sheila. I mean, tell me if this is wrong. I'm looking back to Cabinet in January, and I asked a question about the CQC report into adult social care, and I was assured then that that this would be coming with an overall report to the Select Committee in March here, in March, regarding the progress reflected in the CQC findings. And it's not on the agenda today. I know I did send you an email about this, and I think I sent it to you too late. But I also don't see it on the Forward Work programme. And I know that this administration talks about transparency, but this seems to me to be that I asked in January, I was told this would be in March, and I'm not sure today where to ask my question, because clearly it's not this. I mean, it's to do with everything, but could you enlighten me or tell me when to ask the question or something? Thanks.
Thank you. Yes, I received your email, and I did take guidance from the response, because that, as you appreciate, it wasn't constitutional to bring it here within the notice period. But I'm going to ask Becky to respond, because she's actually been dealing with this. So I don't know if you want to just respond. It isn't agendaed. I will allow it to be responded to at this moment in time for you as a courtesy, because you've asked it. Okay, thank you.
Yeah, thank you, Chair. So the committee will remember they received the update from Ian Wake, the Executive Director of Adult Social Services, as part of the Chair's announcements in January. And that was a decision by the Chair to bring that information to the committee sooner than later. And through part of that, what the committee were advised that series of Forward Work programme items that you've got cover those elements of the CQC report, and those deep dives will allow you to look at not only the transformation work that's going on, but how that feeds into addressing those issues that the CQC raised. For example, the next item is on the all-age carers strategy, which you'll be aware is one of those key issues that was raised as part of the CQC report. So that was the process that was taken, because obviously leaving it till now would have been too late. So that was the Chair's decision to do that. The Forward Work programme is owned by yourselves as a committee. So if there were any issues that you wanted to raise, that would have been appropriate to raise that under the Forward Work programme item back in January. But obviously there was one item that was agreed at the last meeting, which was has since been put on and is in the draft before you today. The committee agreed the Forward Work programme as it was written, so obviously what you've got is what you as a committee have collectively agreed to look at. So, yeah, the process is this committee owns your work programme, and it's, you know, a steer may be given, but ultimately it's for this committee to decide what you want to scrutinise.
Thank you. Does that assist you?
It does, and I hope the committee do want to scrutinise. Thanks ever so much.
Thank you. It was it's always been an intention that to bring you information, and that's why I felt it was appropriate that the last meeting we did have Ian Wake here to answer and take questions on that report, which he did. It wasn't scheduled on the agenda at the time, but it was imperative to me for openness and transparency that we actually, because the report had been published and there'd been comment on it in media and everything, that this committee saw it and had an opportunity, and I feel I did give you that opportunity to have a look at it then, and we will move forward with the specifics of what Ian detailed that need to be addressed within that report. We're gradually on our Forward Work programme, as Becky has alluded to, working through some of those issues that report raised and highlighted, and I'm no doubt there will be more to come. I'm sitting here today thinking this could be my last meeting. I don't know. just don't know with the elections, and it's for me, it's work that I have a desire emphatically to continue, because I think it's important that we do take a CQC report very seriously and have a look at it. And I'm crystal ball gazing now. Who knows what's going to happen? I don't know. So I'm going to move on now, because I think I have exhausted my list of speakers, unless anybody else would like to ask anything, because now is your chance, please. And I'm having a look and I don't see anybody raising their hands. So, content of this report, provide member level support for the work that is being developed and delivered, to review and provide commentary on the draft principles. I think we've explored that and commented really well on that, and I hope officers have taken on board lots of the comments and the suggestions that my councillors have made. I know that you do, but it's imperative that you do, otherwise why are we here? And also to support the development of a learning culture and an organisation that will inform our commissioning approach to practice. And as I come back to, I still think we need to be promoting the career, making more of the work of a carer in paid employment on this occasion, more of an aimed career. And I'd like to see more educational opportunities within that structure as well. But councillors, can we agree the recommendations, please? I'm having a look round. Thank you. Thank you. So we're going to move on then to page 39 of our agenda, the all-age care strategy and support for carers. Now, this ties in quite nicely with what we've just been talking about, actually, and about the CQC report, because this is something that was highlighted in that report. So I have officers here to present. Would you like to kick off then, please? Who's going first? Is that Marie?
Yeah.
Yes, lovely. Thank you.
Thank you. So we brought this paper to the committee following a request for an update on the all ages carer strategy and the actions taken to address the findings of the recent CQC inspection. So as you rightly say, it ties in very nicely to the current discussion in the room. We have highlighted the aims of the strategy with the I and we statements that were co-produced by carers and sought to highlight the key findings. We have presented the recommendations for the committee, which you will have seen. We have highlighted how we offer support to carers in Norfolk, both through our commission service, Carers Matter Norfolk, and in social care more widely. This has been framed within the transformation actions, which again aligns quite nicely with the paper that you've already scrutinised today. Carers Matter Norfolk provide both an advice line, an information and advice service, short breaks and carers assessments. We've detailed the quality monitoring and the impact monitoring for this service, and we've aligned the quality monitoring with changes made within adult social care. Our wider offer includes assessment and support planning for more complex situations. We have respite and breaks and information and advice, community events to provide information, and we have noted how we're recommissioning 10 respite beds. We've recognised the connection between the well-being of the carer being linked to the right care and support being offered to that person that is being looked after, as noted in the CQC findings. We have detailed how we have restructured our organisation to address quality. We've explained how we have clear structures that have been put into place to listen to the voice of carers. We've co-produced and implemented ways of hearing the views of carers, gaining that feedback and communication of the actions taken as a result of that has been agreed and implemented. Quality governance changes are ensuring that feedback is gathered and acted on. So we're not just gathering information from people, we're using it and moving forward with it. So I'm happy to take any
questions? I'm now having a look. I have Brian Long. And I have Sharon. Is there anybody else, please? No. A question from Brian then, thank you.
Yes, thank you, Chairman. always good to see new iterations of the all-age carers strategy, and I remember it coming along to when adults and children's was a combined select committee. But one thing we seem to have lost, although a lot of the ethos is within what I see here, we seem to have lost the Harwood Care strategy. Dave Harwood was former portfolio holder. I know it's a few years ago, but he sort of championed this direction, and obviously we now passage of time, seem to have lost reference to it. But actually, the ethos and the drive behind what he had within that document, gosh, I'm trying to think back how many years ago we're talking now. But nothing's really changed in what he wanted and he looked for. I don't think that he was particularly a visionary. He wanted to do the right thing by people and the right thing by carers. And I just, wonder where that went from our thinking, or have things evolved that much that we now no longer need that arrangement.
Thank you. That was probably certainly before my time, but I'm very happy to pick up what that report was. I would hope that any principles through that have kind of come through. I mean, I guess the one thing I would say is that we're really proud of the work that actually was led by Carers Voice in terms of the all-age carers strategy we now have, as you mentioned, that's been to committees before, was explicitly co-designed with carers. But I'm very happy to take an action away that we can check what that document was that you're referring to and make sure that anything that was in there we're aware of. So sorry that we're not able to give you a direct answer.
We're looking around for who's been here longer than me.
Yeah, probably me.
But bear with us, I think possibly one of my colleagues might be able to.
Actually, it was very much during my time as well. David Harwood was the cabinet member at the time for adult services. Pardon?
Sheila, I believe you took over from him as
I did take over for him for a period of time, and unfortunately he was very ill and passed on. But his legacy at the time, and I can see someone waving at the back there, Suzanne, was this. It was a care charter, and it was very much based on some of the information really that is in the ethos of this report we have today, but it was his legacy, and it was we had his family here and his wife, and it was launched, and it was a very important piece of work at that time, and he was a gentleman that was very passionate about his work and very person-centric. And for me, I'm really glad we've raised it this morning, because I think it needs to be referred to. Because although it's not mentioned in this report, I do see a lot of reflections in this report of what he did establish at that time. Suzanne, I don't know if you want to say anything.
just to say, as someone who maybe has been here a long while, that yes, and it started, so it was a charter, it was something that our providers could sign up to, the leaflets and cards are related to that. I think that real ethos, though, absolutely got embedded. And when we look at our contracts and we look at the things that are required within our contracts, they are really embedded and integrated in the terms and conditions, the contract arrangements that our providers are signing up to. So thinking about ensuring that services reflect feedback, all our providers have to demonstrate how they are doing that. And we work with Norca and our providers around how the sort of methods that they use for that, helping people find services that will work for them, and reporting to commissioners where things can work well and or could work better. And that is very much the ethos, say, within all of our contracts. It's also embedded in the work that's been developed around things such as the Real Care Deal as well, thinking about better ways that we can reach out to more people, find people's, hear from people's lived experiences and bring that back into how we are shaping services going forward. as Sheila will know, the work of making it real is again another really good example of that.
Yes, I should have split myself into two because they've had a meeting this morning, and it always seems that they do tend to clash now with these meetings. But I do go and see them, and I very much keep in touch with them, and I get all the paperwork and the minutes and the agendas, and I do like the way they are actually pioneering still the easy read opportunities for members and further afield. That for those of you who don't know, that the sort of documents like we've got this morning would be converted, I think the word is, into easy read and are more using illustrations and emojis and things like that to disseminate the message to people who perhaps are not as keen on these heavier paperwork pieces. I'll call them that. Ian, did you want to say anything?
Yeah, thank you, Madam Chair. It's just on that item. The Harwood Care Charter was signed when I was Deputy Leader of the Authority, and David was a dear colleague at that time and really was passionate about ensuring that the carers had their voice via the Charter. It is actually still listed as the Harwood Care Charter on the County Council's website. Now there is there's meant to be a leaflet and a charter card, so perhaps if we can revisit that, I'm sure that would do the memory of David justice, and also the residents who would benefit from the charter being re-established. Thank you.
Yes, lovely. Thank you. Sharon, thank you.
Thank you, Chair. In a perfect world, Nick knows, I would like a database built with all carers so they get a call every so often just to check in to make sure they're okay, because some people will not come forward. But I do have 3 questions, okay? What is the uptake of carers joining care? Hang on. What is the uptake of carers joining Care's Voice? Are there any notable gaps? And what are you doing about to encourage more carers to come along if you need them? And then when people get their disability facilities grant, are you then following up just in case there is a carer in there that may need support? And then we're going digital. Is NCC ensuring digital tools like Ask Cora are included in the programme Tech for Skills for Life to ensure it is accessible to carers who are offline or digitally excluded? Hence why it's written down, because I have trouble reading it. Thank you.
Right, who's going to take that one, please? Marie, thank you.
Yeah, I'm happy to take those questions. I think they're really important points. We have, in terms of Carers Voice, of course, I'm not privy to their information about their membership and all of those things. However, I do know that they are expanding all the time, that they have a very successful Carers Passport service, and I know that we talk about, to the people that we come across, we promote them and say, these are the people who have got good information for you. I know that we have good links with them, we meet with them regularly, we champion them, and we use a lot of their resources and their expertise within our co-production and the things that we're achieving on a day-to-day basis. I'm having a 2-weekly catch-up with Carers Voice to find out what the key issues for carers have come through, and where we need to be addressing you know, any concerns that have come through and what's going well. So there's some really, really great links with Carers Voice, and we absolutely promote their services for people to join that and have that available to them. We also run the advocacy services, and we also, sorry, that's not quite right. We also attend their partnership boards and make sure that we've got really good collaboration across the system. So that, as you say, the Making It Real board will be talking with Carers Voice today, and we promote that as far and wide as possible.
I think your point about registers, some of your questions relate to that, I think is a really important one. So just specifically on the Disabled Facilities Grant, it should be the case, so most of the DFG is administered obviously by our district, borough and city councils, but when their staff are talking to residents about the DFG, they should all be aware of the offer of support for carers and support them to access that. Obviously that will vary in practice depending on which district council it is. And then your more broader point is that within our system at the moment, each organisation or entity has its own register of carers, so they are separate. We have done previous pieces of work with other partners about bringing together some of those registers, and I think there was an opportunity for that in the future, so there's more of one unified approach. I think all partners, including ourselves, we all have face a challenge, which is that in Norfolk there are around 95,000 people who are carers, many of whom, and I know from our conversation before, don't actually necessarily recognise themselves as carers either. And so a big part of what we try to do, as well as our other partners, Carers Voice, General Practice, is to find and identify those carers so we can offer them support. We've seen, certainly in terms of the Carers Matter Norfolk offer, which is the one that Adult Social Services Commission, growth in demand for that support from carers, but we want to support more of them, and identifying them through the DFG, through GP conversations is really, really important, and part of the reason it's important that people are aware of the offer for carers out there, both residents but also professionals as well.
Thank you. Did you want to come back, Sharon, at all on anything?
No, that's fine, thank you.
Thank you. Right, I have Brenda next, and then after that I've just seen Brian and then Ian. Thank you.
Thanks, Sheila. It's me going back to the CQC again. A deep dive. I don't think the comments on 2.13 is an example of a deep dive. Basically, it's saying the overall rating requires improvement with a score of 56%, which is 6% away from good. And then it goes on with really positive things. That isn't a deep dive. That's just, well, we almost made it. It's like me saying, well, I almost got an O level in Latin. Well, I didn't. I'm concerned, and I'm concerned for a number of reasons. I'm thinking back to the comments that Ian Wake made when he came to this meeting. I don't remember us having an opportunity to ask him questions, but that might just be my memory failing me. You see, Sheila, you've made some very valid points, and that is that none of us know who's going to be here, whether you're going to be the chair, and an excellent chair you are of this meeting. And I'm concerned that with the volcano of the election that's coming up, the dust will settle, and the CQC report, my concern is it will be forgotten. It will just be buried. And I don't think the comments on 2.13 constitute a deep dive into this subject. This really matters to me, and I know it matters to you because you're a good woman, and I'm sure that the committee is concerned. But this is just like, well, it wasn't too bad, really. And so often in this committee we hear, well, we weren't quite at the bottom, so that's good. I'm troubled by this. That's the comment I want to make. Thank you.
Thank you. You flatter me. However, I think the points you raise are very serious, and it does concern me as well. And this, we weren't having elections, then we were, and then we are. Personally, this there's an important piece of work that needs to be carried forward, and I hope that whatever happens, if I'm not here, my legacy will be that I promoted it, because I do think it's very important. And I think in some respects we do need to look a bit deeper at the CQC report. It was presented to you, as I explained before, because it wasn't an agendaed item, but it came at a time when I felt it was important that this committee, seriously important that this committee saw sight of it. And Ian Wake presented it, but given the restrictions on the Constitution, I knew then, and I was advised that he wouldn't be able to take questions, he would present. But that, for me, it was that, or you didn't get it. And I wanted you to be aware of it and have sight of what the issues were. And I'm hoping very much, whoever, if I'm here, that will be great, because I will try and promote this and carry this forward. If I'm not, whoever my successor is will take this as seriously as I have and move this forward, because it is important. Otherwise, there is no point in us in the CQC coming to see us in the first place, because I spent about 2 hours on a MST call to them discussing all sorts of things. I was interviewed as well, and I had things to say about committee work and what we were looking at and how seriously, and I say seriously but enthusiastically we took it, because we do. And people who come to this sort of meeting take very seriously the service that we provide. I don't really know what to say other than, you know, as I said earlier, we're crystal ball gazing. Let's hope we have a good outcome, whatever way, and that whoever takes this forward takes it on board. I know the officers have, and I'm sure that I will be assured by the officers and reassured that they are not of acceptance, that it is just could do better. It's got to be looked at. And I know that Nick, I think you're taking it forward, aren't you, as well? Perhaps you'd like to comment.
Yeah, thank you. No, and I take on board your comments. What I would absolutely assure yourself and all members of the committee is that we absolutely, took the findings from the CQC really seriously. The areas of positivity, but also the areas of improvements. Our transformation programme, and if Ian was here, I'm sure he would say the same, is entirely built off that principle of we were reflective on areas where we're doing well and areas where we have improvements to make. And the vast majority of our transformation programme is designed to be addressing some of those improvements that we'd already self-identified, but were also in the CQC report. And indeed, are part of the expectation of the CQC after they provided us with their report is that we have an improvement plan. And the majority of that improvement plan will be made up of actions that are within our transformation. So we are absolutely aware of them, and part of what we're doing as a department is to address them. I just want to, assure the committee that as officers, that is really very much top of our mind and all of our teams.
I know you are, because I come to meetings and I talk with you, with Alison and other councillors, and I know how genuine you are in what you say, so thank you. Stuart just wants to say something, please.
Yeah, thank you, Sheila. I would just like to also associate myself with the comments made by Brenda and Sheila. I think they're very, very important. However, I'd also like to say that I have confidence, and I'm happy to put my name and put my reputation on the record. I have confidence that what Nick was saying, he's genuinely looking to address it. And I really do mean that. However, I also think it's very, very important to pick up on the very valid points that Brenda's made and Sheila's reinforced, that, to a future committee, whatever the makeup of this committee might not even exist. A new administration might change the makeup of committees. However, if this committee does exist under whoever chairmanship and whoever's membership, it is very important that I do think the CQC report is further analysed, and to ensure that the initiatives being put in place under Ian and the Nick and Chris and all the team are representative of the areas where effectively we performed, let's face it, not good enough within the report. But as I say, I do tinge that with a degree of confidence that I believe we are definitely addressing that and moving in the right direction. But I do think, and again, to support Brenda's position and what Sheila said, it needs to be in the public domain, and it needs to be crystal clear to our customers of the service, the residents of Norfolk. So I would strongly reiterate that, and hopefully that will be picked up going forward.
Thank you. I'm going to move on now to Brian. Thank you. Brian Watkins, thank you.
Thank you, Chair. Well, I can only agree with what's been said by the last few speakers, by yourself, by Councillor Clancy, by Councillor Jones. These are very, very important matters indeed. The CQC have highlighted some very serious concerns. So, of course, it goes without saying that it's crucial that the report is not forgotten, that it is not swept under the carpet. I am sure from what Nick Clinch has said that the department are well aware of that, and they are not going to allow that to happen. and that they will do whatever is necessary to make sure that any deficiencies that have been outlined in the CQC report are addressed in the proper way moving forward. And it is incumbent on any new administration that comes into power on this council after May the 7th, whoever it is, whatever party, whatever combination of parties, that, this issue is taken very seriously indeed. And I do hope, and I agree with what everyone has said, that, we need to have a deeper dive into all of these issues and make the decisions that are necessary to bring about the improvements that we all wish to see. I think I'll leave it there.
Thank you very much for that, Brian. Ian, thank you.
Yeah, thank you, Madam Chairman. I just wanted to ask the officers some questions about young carers, which I'm particularly interested in understanding a little bit more about via my work with the Benjamin Foundation and the work they do to support young carers around the county, particularly with respite holiday care in the summer and also activities, etc. At Christmas. One of the things which they understand is working within schools. They are able to identify a lot of young carers because they are the ones who are able to use the iron, to use the oven and cookers, and those things indicate that those young children in particular have got a greater caring responsibility than their peers. So that's an important element. The other one is around how we're able to identify them, because under 2.2 there's lots of lofty activity there about, as a carer I can do this and I can do that, and as being part of the carer's voice. I'm just wondering, one, are we working with schools to identify young carers? What support can we offer? And two, in terms of a carer's voice for all ages, how are we reaching young people to be able to have a voice about their care needs? Because it has to be done, very, very sensitively within the family context. So just some interest on that. Thank you.
Thank you.
Yeah, really important that we think about our young carers as well. Absolutely vital. Those carers at school, trying to manage their schooling and doing and all the activity and responsibilities that they've got at home. So we work alongside our children's services colleagues primarily here. There are lots of initiatives working in schools around creating schools which are champions for young carers, to identify those young carers. And they have the Transition Action Plan, which was rolled out last year, which means that young carers can identify their needs, what their aspirations are, what their goals are, how their caring role at home is impacting that, how we can help them out of that caring role, really, because that's the goal essentially for young children. So the schools will help and support them to keep that information and those goals, and as they go through into adulthood, that can come with them. So there is work on that. The Transition Action Plan is very much in place.
I just want to say thank you that there is that action plan. So as they become 18, that there's not a gap. It's then continuous understanding of their needs as they become adults themselves. Thanks very much indeed. Thank you.
I think it's important, and I know that you work with children's services in this department. Anecdotally, this will make perhaps some of you laugh. I'll very briefly be excused the story of being the chairman of the council in 2009-10, and one of the themes I did some work with was the young carers in Norfolk. And my chairman's secretary got me some sponsorship from a funeral director, actually, to take a group of young carers to the pantomime at the Galston Pavilion. And it was a wonderful afternoon, and we were transported to, we met here at County Hall, and we were transported to Galston, ironically, in the funeral cars. And it was a cavalcade that went across the A47 to Galston with me in the front with my civic chain on, and this group of young carers, all in the mourning cars. And I've never forgotten it, and I have a wonderful memory of it. And it was quite amusing at the time, but I share that with you. I hope you'll given me that grace to have shared that. But you know, we do take it very seriously, and I know even in my own division of young people who are caring for their parents and other family members as well, because it's just not caring for your parent, is it? Sometimes it's caring for another sibling, your brother or your sister. And I've got that, and I'm supporting some families in Helston at the moment. Brian, thank you.
Thank you, Chair. Just following on from what I said earlier, I appreciate these are early stages and there's a lot of work that we need to put into sort of considering what improvements are needed. But just on a preliminary level at this stage, are there any ideas that you have on how we can perhaps work better with Carer Matters Norfolk to sort of bring about improvements to the support that we offer to carers across the county? And the second question is that the CQC report did actually praise the emerging learning culture, but said that those improvements were not yet visible in the outcomes that we have. So I wondered perhaps if you could comment on how that learning is now translating into measurable service change. Thank you.
Thank you.
Thank you for both those really helpful questions. So I'll pass to Marie in a moment to talk about improvements with Carers Matter Norfolk and ongoing work with them. In terms of that learning culture, yeah, so I think at the time when the CQC came in, obviously we were moving into our new way of working, new management team. There's not one single thing, I suppose, that kind of gives you an example about how learning is being built into the way we work. I'll give you a couple of specific examples. So one of them is that our practitioners now are increasingly working using something called reflective practice sessions. So where they're directly working with residents, like carers, they then bring that back, reflect together about what they're hearing directly from a resident, and then use that information to essentially improve their often future conversations with a resident in the future and that relational way of working. So that's very much on a practitioner to resident kind of basis. The other side of it is then, for example, on a commissioning side, we're increasingly using information that we get, for example, from Carers Matter Norfolk in terms of data or insight they have to change the way in which we commission those providers as well. So moving away from just counting activity, so how many people have you seen, to actually getting in much more insight and information about what have the outcomes been for carers. And I think actually our relationship with Carers Matter Norfolk has been one good example of where we have some of that practice already. So our arrangement with Carers Matter Norfolk is essentially commissioned under three key outcomes, which is improving the well-being of carers, increasing the number of them that are known to us, and sustaining their caring role. And so much of the way that we learn with Carers Matter Norfolk is based around those outcomes rather than a traditional kind of key performance indicator way of working. So that's kind of learning. I'll pass to Marie to maybe talk a bit about some of the work that we're doing with Carers Matter Norfolk on your point around future improvements.
Thank you. So when we are talking about the improvements that we're looking to make with Carers Matter Norfolk, the same applies within Norfolk County Council, within the direct practice and the sort of the lived experience of carers who are actually needing that support and improvement, the felt, the actual real impact, the human impact. And for that reason, Carers Matter Norfolk have begun to improve how they're getting their feedback and understanding what the experience of the carers is like. They're quite a data-driven company. They have lots of stats about what's happened when and how people have moved through the system. But now we're looking much more on what the human experience of that has been. At the 12-month part, people are receiving a call to say, how are you, essentially? Has the things that we've done and put into place, has that continued to help you improve your well-being? And from that, we will now know, we do know whether what has happened has been effective, essentially, in a direct way. In my audits, because we complete regular audits of the quality of the work, we're looking at Now we're including the voice of the carer a lot more, so it's not simply a case of reviewing records, written records, or looking at actions. It's actually incorporating the lived experience and the voice of the person that was receiving that support. So we get a much better idea about what the experience was like. We also have a new quality framework, which we're starting to embed under the transformation within Norfolk County Council adult social care teams. There is a new approach being trialled and learned from all the time about how we support our teams to identify what the people in their particular place need, what they're asking for, what they want, and how they're being worked with. And each of those teams will be developing, okay, this is the areas that we need to improve in, this is what the needs of our residents are, this is what we're strong at, this is where we're struggling. And then they're developing the practice and ongoing support around that. So that commences quite soon. We're also applying the same principles to Carers Matter Norfolk, who are also taking those experiences of those carers, looking at it and amending what they're providing accordingly. So, and I guess there's one further element. There is a large Norfolk-wide survey, or it's actually England-wide survey for the, the acronym is SACE, and now I've got to remember what the actual social, what? Survey of adults. Survey of adults in care evaluation, I think. So anyway, so it's a really huge survey all over England, and it's biannual. And up to this point, we haven't included people who have been through the Carers Matter Norfolk service within that, but they will be now surveyed on a biannual basis. So we'll get lots of good knowledge from that about how carers are feeling, both in that service and external to that service.
Thank you. I think there are a lot of carers out there who don't actually think they're carers. You know, I look after my 95-year-old mother. My husband helps me. My husband helps me because of my shoulder injury. But I don't really think we're carers. We're family. You know, we do it. And sometimes I just get a little bit concerned about, unless you pronounce yourself as a carer to the survey people or the county council, you're not included, but you should be. So how do we get to those people who don't think they really are carers, but they are?
So I can attest to some of what we're doing, if that's helpful. So that is, of course, a very important part, that we don't necessarily think of ourselves as carers. We don't necessarily think, oh, yeah, and we shouldn't have to be labelling people, this is what you are, in order for them to get the support that they need. But what we are doing is we're doing lots of proactive intervention work. So I'm sure you're very familiar with the proactive intervention programme, which is reaching out to people in that early intervention way to say, okay, so people who have maybe hit these particular areas and that we know of through these external areas, this is we can contact them and we're reaching out to them and identifying them as carers. We're not saying they have to be identifying as carers, but we identify them as carers, and we can say, you know, this is support and offer that's available to you. We're also moving to a much more community-based approach. We'll be visible in libraries, we'll be out there in communities, talking to people, providing support. We go to events, we have our development workers who go to different events and just talk to people about what their experiences are. And they're passing that information and saying, did you know, I can see that you're getting information for your mother here, or your uncle, or your whoever. Did you know that these particular things are available? So we are making steps to proactively look for what people who are carers who might not necessarily consider themselves and may not have ticked themselves on the old census box, because lots of people don't consider themselves that way.
Thank you. Councillors, have you any more questions on this item on the agenda, please? Look, no, fine. So if we move to page 39 then, and I change my glasses so I can read it. So it's page 39. There are recommendations, action required. To note the progress made in driving forward the requirements laid out in the All Ages Carers Strategy as part of the wider Norfolk County Council transformation. Endorse the pursuit of progress in developing a preventative and quality support offer for carers. And 1.3, request members of the committee to consider how they can support promotion of the care support offer for carers. I think we've well and truly done that this morning with our comments. I thank you very much for them. I hope the officers are listening to us and we'll take that forward. So can we agree those recommendations, please?
Just one thing.
Yes. Oh, excuse
Just
me.
one thing, Chairman. We did mention the Harwood Charter.
Yes.
If we could ask officers to revisit the Harwood Charter and effectively update it to 2026, something along those lines. Not necessarily call it, but just have a look at it to make sure, you know, A, is it relevant to today, 2026, and B, can it be integrated into the excellent initiatives you're putting forward now?
Thank you for reminding me of that. Yes, can we do that, please? Chris, did you want to say something? Thank you.
So absolutely, as we're looking at the charter and as Suzanne described, you know, I think we can very clearly demonstrate how we're absolutely following the principles that were contained within that charter. And we can absolutely provide an update to the select committee that will reassure you on that point, definitely.
So, councillors, that's absolutely fine. Councillors, are we in agreement with the recommendations, including the review of the Harwood Care Charter? Agreed. Lovely, thank you. I'm going to propose now, for my benefit more than anything, that we have a 5-minute break. Thank you. Shall we reconvene, please? You can see I've done my chairman's training, can't you? I'm using the right terminology. So following our adjournment, we'll move on then to item 9, please. So this is the Norfolk County-wide Community Safety Partnership scrutiny sub-panel meetings. We've had the debate before, we've been there, done that, got the T-shirt as to why this report comes to the committee. So we probably won't need to explore that one this morning, but I have Councillor Brian Long here with us this morning, not only as our but he's also the chairman of this particular scrutiny sub-panel. So, Brian, would you like to present your report, please?
Yeah, thank you, Sheila. Thank you, Chairman. It's report obviously submitted as written. As you mentioned, the sort of whys and wherefores of why we report here is again included within the report. I was hoping that there would be a link, a hyperlink within the agenda as to the Norfolk County-wide Community Safety Partnership Plan, against which obviously we judge and scrutinise. And unfortunately, through technical hitch, that hasn't appeared on the agenda. So I would ask if it's possible that link to that plan could be included, perhaps with your minutes, so that members can see against which we are judging. Recent work, as outlined in the report, included fraud overview, an update of how we're dealing with and trying to help people avoid being the victims of fraud within the county. We also looked at domestic abuse related deaths, which used to be domestic homicide reviews. They've now been renamed. The number of those was quite shocking, to be honest. And we also looked at what was deemed to be the winter of action, which followed on from a similar scheme that operated during the summer months, and that was looking at antisocial behaviour offence and things within the nighttime economy and tackling retail crime, etc., in specific locations across Norfolk. One of the things that is different with Norfolk, lots of areas have their own sort of district-based community safety partnerships. We have one that covers the whole county, and obviously that means we get learning from across the, you know, from Great Yarmouth to King's Lynn and from Cromer down to Diss of what goes on where and what's the effective way to deal with. So that has proved an effective way. One of the things we did ask as a committee was that when we have the updates, we actually look towards statistics of what improvement has been made, which I think is something that's been not too included with our report. But I'm happy to take any questions, Chair, and failing which, obviously, they meet again. I think the next time will be after elections in July, so it seems an awfully long way away. That's the next time they're scheduled to meet. Thank you.
Thank you, Brian, for that. Are there any questions? Thank you, Brian. Another Brian. Yes, thank you. Brian. Team Brian
Thank
today.
you, Chair.
Yes.
If I could just ask Brian, he referred to fraud in the first part of his presentation, and just to ask Brian what new non-digital channels be used to reach our older residents, and how the panel might, how your panel will measure the reach and impact to ensure that we are doing all we can to mitigate our residents from being victims of fraud. That's the first question. The second one relates to the winter of action that you referred to and measures to tackle antisocial behaviour and retail crime, and when your panel can expect outcome data on that. Thank you.
So with regard to fraud, that was one of the issues that was highlighted within the questioning from panel members. You know, the online fraud, you know, it's very easy for those people that are always online to be, you know, contacted via sort of social media channels and so on to make them aware that fraud is happening. It's those people that aren't usually always online that are in that way hardest to get to. And we made specific reference to the sort of traditional media, such as the Eastern Daily Press was particularly highlighted as a communication channel to raise with audiences that you know, you're much more likely to be a victim of a fraud than a sort of traditional house break-in or burglary. That was noted by those presenting, and I think they're going to try and look to get wider awareness in through traditional channels, so as not to just rely on electronic means of contacting people. And literally, while we've sat here today, I've had a pop-up email that came through to my private email account that I know is a fraud. With only just glancing at the first bit of it, I know that it's a fraud. You get tuned into it. And I think we need to get everybody tuned into the fact that these are bombarding us daily. And on that basis, you know, every method that we can raise awareness is a good method, because if it pricks the conscience and you think, oh yes, I've heard this is doing the rounds, in this, you know, and on that basis we'll help to beat the fact that it is relentless and evolving and getting smarter as, you know, as we adapt and get used to what's coming through. So the scammers try and get smarter with how they commit the fraud. So it's an ongoing situation. In terms of the winter of action, yes, I quite agree with you. We need to see the stats and figures of you know, crimes and of the various different types reported in the localities where this was done, and compare it to previous years when it wasn't done. As a committee, I don't think we've had that data yet. When they've got it and it's fully established, obviously it will be hopefully reported on to us, because we have it as an ongoing piece of work. And I'm just looking to Becky in case she's got it. Have we had those figures yet, Becky?
Yes, I'm more than happy. Thank you.
Thank you, Chair. One of the takeaways was to bring the outcomes of the winter of action back to the scrutiny sub-panel. We've been in conversation with our colleagues at the Community Safety Partnership, and we're hoping that they're going to bring forward a proposal to the next meeting, which is in April. We've got one early. Yeah, we've got one very end of April. So we've asked them if they can put to the committee under the forward work programming item their proposal to bring back that overarching look back, not only on the winter of action, but also on the Safer Summer Streets initiative, and bring both of those items together in one report, looking at that sort of 6-month period of action.
Thank you. Stuart, thank you.
Thank you. I'd just like to pick up on both what Brian and Brian mentioned, re the non-digital fraud. I'm actually involved in helping an older gentleman who's bought door to door. We've involved trading standards involving a significant amount of money, a lot of thousands, lots and lots of thousands. And it is still a major problem. Often, unfortunately, I think we need to give this a lot of thought, because stickers that go on the door is almost an invitation, by the way, an older person lives here, so I'm going to knock on the door in any case. And there is a big risk to this, and I'm having discussions with trading standards about this at the moment, because I think people are becoming more aware, and all of our online banks, etc., are all warning us about fraud and scams and this, that, and the other. For us who are using online banking, they don't let you make a payment now until you've done this and done that, which is a good thing. It's a very good thing. But I do think we again, and I often mention this, and I'm going to reiterate and reiterate and reiterate, there is still lots and lots of people out there who do not do everything online. And I've now subsequently found out that this particular fraudster, who was a rogue trader selling, trying to do roofing improvements, and has actually committed fraudulent actions and behaviours to 3 older residents. They're just the ones I know about on the same estate. And it could well amount to a lot of money. And I just think we need to look at this. And if I could ask Brian, if you could look at this through the committees, how we possibly could address this and get better to people. I mean, I'm for example, just going to do a leaflet drop in that area, just putting something through people's door, warning them about it. It's really simple. Just don't buy door to door. If you need something, you don't actually need somebody who's canvassing sales or unsolicited sales. So the door, buying it at the door, you know, you'll make a considered purchase. Friends, family, relations. You go to the shops, get somebody else to go to the shops, or you go to the builder's merchant or whatever. You don't need actually to buy something at the door. So I think it's really important that this is addressed, and if your committee could do anything, that'd be great.
It's definitely something that I think will be ongoing, and actually you mentioned it, Stuart, the relationship with the partnership does include those from Trading Standards, and obviously they're picking up the gen from reports that are you know, coming through of that type of thing. You know 3 in close proximity in your division. There are operators out there all the time. And of course the trouble with it is those bona fide businesses that do trade door to door, and there are bona fide businesses that trade door to door. There's a reintroduction of door to door milk deliveries, and they send people out, you know, to canvass interest in a locality. And I mean, they're door-to-door. So now the very people who would benefit perhaps from having a milkman are probably in those areas that say no cold calling. And they, genuine people, do honour that and don't knock. But actually the people behind the door could really benefit from having milk and bread and orange juice, whatever, delivered to the door, because that's bulky and heavy stuff to get back from the shop. So, you know, you've got to strike a balance. But, as you've said, there are rogue traders out there who prey on the vulnerable, and we do need to continually highlight that, and we'll continue to do so.
I think we need to be particularly careful and send out a message about where you put key lock safes and things, because they tend to be right by the front door, and anybody who is, you know, not appreciative of that can, I know you need to push in little numbers, but I've had experience where it's very easy to get into one of those sometimes. My mother's in particular. And we've hidden that one up now. That's hidden on the bungalow. We know where it is. And 1 or 2 other people do. But I think it's a lesser of 2 evils, really. You put no call calling, you put all these stickers in your front door, no call calling zones, etc. What message is that sending? If you put a key safe on the front door, what message is that sending? Yeah. You know, I'm a vulnerable person. I'm on my own, perhaps. It's a very difficult one, and I know that's why a lot of the police have people that go around and advise as well on how to make your home safer. But it is difficult. But as I agree with you, there are a lot of companies that do go around and they do provide door-to-door canvassing to get their services. The milk is a prime example, because they've been around Helsden recently. I don't know what the take-up was, but people are very wary. I was talking to them because they came and knocked on my door, and people are very wary of them, yet they are very genuine. And then on the other hand, there are some that are not so genuine. So we have to be careful. I have Brenda, and then I have John, and then I have Ian. Thank you. To speak, thank you.
Thank you. I just wanted to thank you, Brian. It's a good report. You do a great job, and I'm not always grumpy, so well done. I think it's an excellent thing that you do. Thank you.
I've never known you to be grumpy, Brenda. Thank you very much indeed.
Thank you. John Ward. Thank you. John.
Thank you. Yes, I just want to ask about this Project Vigilant, the Good Night Norwich campaign. I'm often in the city late at night, going to the cinema or the theatre, and walk back through the shopping streets, and it's a very unpleasant experience. There's groups of young people drinking in the streets and shouting. There's people sleeping in doorways. There's smashed windows. It's very unpleasant walking through the shopping streets of Norwich late at night. So I wonder what this Project Vigilant is actually doing, please.
I think personal experience like that is often helpful, and I think that's something we will have to address back to the panel, through the panel, because if the lived experience is different to what we're getting told, then we need to highlight it. And I think the other point that, in addition to the point made by John here, is also this, are we almost highlighting the vulnerable with no cold call and key safes on the door and stickers in the window? Is that highlighting them too much? And you know, what's the rationale behind not highlighting and actually, as the chair said, hiding the key safes a bit out of the way? I know, you know, they've got to be findable for those who need to find them in a hurry and desperate, but out of the way that doesn't say, look, this is a vulnerable person that lives here. Of course, it could identify a holiday home. They tend to have the key safes as well.
Thank you. I agree with John Ward about walking around Norwich. Now, it's a very different experience to when I was young. I took myself off to the Theatre Royal the other night on my own, and even walking out of the theatre across the road down to the Forum car park, I felt as a female on my own was, you know, not the best experience. It's very difficult, but there is a night culture in the city now that can be quite daunting to some of us, and yet it's difficult. I've got a charity in Helston called Norwich Care Support, and they go into the cities regularly in the evenings and give out welfare and all sorts of things, and the numbers are increasing. Doing particular work with them on they're giving out food and soup and all sorts of blankets and tents and all sorts. It's I talked to the lead there, Eric, about it, and it is very it's becoming more demanding actually. So I think that's something you could have a look at as well. Right, Ian, thank you.
Yeah, thank you, Madam Chairman. It's just going back to no cold calling zones. In balance, I think they're a good thing to have. Yeah. I've certainly got a number of my division where members of the public have come together to, you know, create a little zone or a few roads have clubbed together to get it. And the threshold is relatively high. 75% of residents have to agree to it. And why I say in balance is because it should indicate to genuine traders that people in that particular area are not interested in having door-to-door sales of any sort. And that's a choice for residents to make. What I would like to see happen, if it was possible, is the whole enforcement of it, because I think that's where sometimes it falls down. Do the police take notice? Do trading standards follow up with the trader who's actually attended? And I must say, you know, those people who do actually attend, who are genuine, will have a different approach to those which are quite hard sales. Now, we had one the other day, a hard sell on the door. It was cleaning roofs, and it was saying, you know, we're around the corner. We've got time to do yours this afternoon. Can we come this afternoon and make us up? And it really was quite a hard sell. So luckily I was at the house visiting at the time, and he soon went. But, you know, for an elderly person on their own, they could easily get talked into signing up to something there on the spot because of the hard sell of, we can give you a 10% discount and do it this afternoon for you. You know, they've only got a foot in the door, these people. So anything that we can do to bolster, you know, the no cold calling zones or any prevention would be welcome. Thank you.
Thank you.
Definitely something we'll look to include, Chair. Thank you.
Thank you. Well, I've come to my the end of... Oh, Leslie, thank you.
Thank you, Chairman. I did have my hand up.
Sorry, I didn't see it. I apologise.
I wanted to ask Brian if you mentioned domestic abuse, Brian, and as this is a committee dealing with older people, is there any evidence that there's that it's got worse amongst older people in domestic abuse? Because sometimes people with dementia can get very violent, and I just wondered if those figures are given to you. Be interesting to know.
I can only relate back to the report as presented. One of the things that was a real eye-opener for me was the age profile of both the victims and the perpetrators in those domestic abuse-related death reviews. And that was way higher than I thought it would be. And obviously that's average ages that are presented to us, but that does indicate that there are older people, not just, young, where you think the problem would perhaps be. So, I mean, we were only looking at the most extreme cases of domestic abuse where it ends in death. And as I said, eye-opening in terms of the stats. But it is something that we do regularly have in our work programme, which is the sort of review of domestic abuse and how it's handled generally in Norfolk. But as I said, the reviews we were looking at were that percentage of the very worst of cases.
Thank you.
Thank you. Is there any other thing anybody would like to ask? This is your last orders, so to speak. I can see. Right, okay then. Well, thank you for that. That's been very interesting, actually. I think the work that you do is absolutely incredible, and it's quite a very broad scope kind of panel that is looking at lots of community things that are so important these days. So recommendations are obviously for us to consider and ask questions and provide any recommendations. And I think really we have done that this morning. And I hope that everybody, including the officers, have, taken that on board as well, because it's very, very imperative that we do scrutinise this sort of activity within our own county. So can we accept the report and the recommendations, please, councillors? Thank you. So the final item on page 61 is the forward work programme. So turning to that, I don't know, Becky, if you'd like to add anything to that, please.
Thank you, Chair. Yeah, I just wanted to flag up with the committee, based on the earlier conversation around social care employment, that the committee have raised that before, and that's currently scheduled for the 13th of January 2027 meeting as a report to come to the committee. And the report as presented is what has been currently agreed. It's for yourselves to discuss that, add to it, amend it as you see fit within this meeting. I appreciate, obviously there's an election in May, but the forward work programme will still be there from that point onwards. So this is still an opportunity for you to amend and update and revise that forward work programme if you so wish to. Thank you.
Thank you. Would anybody like to say anything? Leslie, thank you.
Thank you, Chairman. I try to get this in at every meeting I attend about my division. I represent Kings Lynn North and Central. And the life expectancy for men in my division is 11.5 years shorter than elsewhere, particularly the coast. And for women, it's 7.9 years shorter than the women in the next division. So I wondered if we could make sure that when we have a public health review, there is one coming up or strategic plan, that life expectancy in deprived areas could be considered. I mean, it comes under health. I mean, it says in the forward work programme about health and healthy eating, but it is a really, it's quite dire, really, isn't it? 11 and a half years. I did ask at one panel about smoking cessation, if we could have that. And I was told that it's been done for pregnant women, but there are lots of middle-aged men who are still smoking who could be encouraged to try to give up, and then their life expectancy might be longer. Thank you.
I wonder if you'd like to respond to that, Suzanne. Thank you.
Thank you. Sorry. Yes, of course. Health inequalities is obviously a really important thing that falls under the public health remit, and also the wider Norfolk County Council has really embraced the concept of addressing health inequalities and considering that in all the policies and all the work that it's doing going forward. So I think this is a really vital thing to review. We've got a lot of information on health inequalities on the Joint Strategic Needs Assessment as well for people who are interested. But we do think about health inequalities in everything we do, how we can address them. In all the work that public health do, we look at what is driving health inequalities, what things can we do, and smoking is one of the key drivers of health inequality, so you're absolutely right. And we don't just focus on pregnant women, we are focusing on quite a lot of the different groups of people who smoke, the key people who could make those changes, and it's one of the vital things that public health do. So I know we've got a healthy lifestyles thing coming on the 9th of September. That will also include the work we're doing on smoking. Will it, Chris? Yeah. So that will include that too. Thank you.
Thank you. John Fisher, thank you. Oh, sorry. Did you wish to come in, Fran? Fran, thank you. Excuse me, then it'll be John. Thank you.
Thank you, Chair. Yeah, I think it's really important, as you say, it's a very important part of public health, and I just want to say how we are working very closely with the NHS, the ICB, to actually address health inequalities. It's a very, very important part of that. But also we all have access to lots of data, actually, but Norfolk Insight as well. You can go down to ward level on Norfolk Insight to look at your own ward and whatever. So if you want even more information, which is probably where you got the information from, yeah. But I'm just saying for the wider audience here, should we say. But around smoke-free Norfolk, we actually got... Well, I'll be on the radio tomorrow morning, 8:05 on Radio Norfolk, talking about our new app, Smoke-Free, which is really, really good. So I just want to say, if you want to have a listen, but also just go on the, you can download the Smoke-Free app if you wish to, particularly if you want to stop smoking. So I just want to say that. Thank you, Chairman.
Thank you. John Fisher, thank you.
Thank you, Chairman. The CQC report has been mentioned a number of times throughout this meeting. And so hence I'm just proposing that we add it to the July work agenda, and hence it will then be in black and white as an item to deal with, whether we're here or whether we're not, or whoever may be. But if it's in and on the work programme, then hopefully it should be picked up. Whereas if it's not, there's a chance it will be slipped. So I'm just proposing that a report from the CQC report is added to the July work programme. Okay. And if it looks to extend the agenda too much, perhaps the officers can look at the agenda and discuss with suitable colleagues how to fit it in. Thank you.
Right, so I've got a proposal here. This is probably the first formal one I've had, I think. Seconder, please. Right, so it's proposed that the CQC report is added to the forward work programme as soon as possible, I would say, but July preferably. Those in favour? It is the next meeting, but you did then say when it could be. So those in favour, please. It's all agreed. Thank you. Unanimous, I think. Thank you very much. Thank you for that, John. I have next Brian. That's right.
Yes, thank you, Chair. Not strictly your work programme, but thank you for members from this committee who have come forward to join the VC sector capacity task and finish group, who have had an inaugural meeting and are due to meet again on the 27th of March. We have the chair with us today. Is that behind me? Keep an eye on me, and I did say that I would give that a mention. Obviously, it will report back in to children's, families, communities, but there will be relevance to obviously your committee as well.
Thank you for that. Do we have any more questions on this report, please? No? Okay, lovely. Thank you. So we're asked to review and agree the forward work programme along with the recommendation, which was unanimously agreed. So that really does draw to an end our meeting, apart from me to just say, I think, one or two thank yous to people. As I said, we have talked about elections coming, and we don't know what the future is going to hold. I know that some people have come up to me this morning who are not standing again and made some comments which were very nice to receive. What I would like to thank is all the councillors on this committee, those who have substituted as well, for the high quality level and fairness of debate, and it's been very constructive, and I thank you all for that very much. That has made life much more pleasant for me as your chairman, and as your chairman I've tried to allow everybody, I feel, a fair opportunity to say what they wanted to. So I hope that you will, think about that as well. And turning to the officers, well, a lot of them have gone, or I know when we had our break. However, I'd like to thank everybody from the officer team in adult social services and in public health for the support you've given the committee, for the high quality of the reports that I thought have been written in a very good, understandable way for us as councillors, for the information that's been disseminated to us, and for the spirit you have shown in taking some quite intensive questioning at times, which is what we're here for, but very much appreciated. And turning finally to my committee, I'd like to thank Becky, because this was a new role for her and for me, and I'd like to thank Stuart, my vice chairman. And I sound like I'm being at the Oscars, but I'm not going to thank my mother, my father, or my sons, or my husband. Well, I think I probably have, but no, I'm not going to go on, and I'm not going to cry either, or make some sort of radical protest speech or statement. But all I'm going to say is, whatever happens, I hope whoever takes this up continues to work hard for the residents of Norfolk, because they deserve us to be questioning what is done and how we do it and the service we provide. And I know we all strive to do our best. Sometimes people don't realise that, but we do strive. And I think a lot of councillors are very, very, irrespective of the party politics, are very devoted to what they do. So thank you very much. And I'm now going to close. This is the meeting, probably, I would think, maybe my last meeting. I don't know. But if it's not, it'll be a bonus to me, but probably not to my husband, who thinks I'll probably be at home to do more housework. But I'd like to thank everybody from the bottom of my heart, all round, for what you have done for this committee. Thank you.
Thank you.